right, well, we're going to go ahead and get started. So thank you so much to everyone for joining in to today's webinar. Today we're going to be talking about Paycheck to Paycheck, our 2017 report that focuses on healthcare workers. And I wanted to start by thanking Capital One for sponsoring this webinar, and also by thanking the Chicago Dwellers Association for sponsoring this research work. Without them, this work would not be possible. And I also want to start by saying, if you guys have any technical questions, technical difficulties or questions, you can use the GoToWebinar module. We'll be taking questions at the end, so please type them into the questions box. And if you're having any problems, I recommend restarting or clicking on this link, the support.citrixonline.com. So with that, we will dive into the material. So for Paycheck to Paycheck, there is both a data tool and a report, and we're going to dive into both of those today. So for the data tool and the report, actually, we look at 203 metro areas and 83 different occupations, and we use wage data from the first quarter of 2017 and compare that with housing costs that we get, both rental and homeownership costs, and see where those 83 occupations can and cannot afford to live. And so we use home prices and fair market rents as determined by HUD. And so in the Paycheck to Paycheck data tool, you can kind of mix and match all of those 203 metro areas and those 83 occupations. In the Paycheck to Paycheck report, we focus on healthcare workers for this year. Every year we focus, we have a different angle, and this year we chose healthcare workers. And so the 5 occupations that we profiled are dental assistants, EMTs, home health aides, nurses, and physical therapy aides. But I do want to highlight there that there are many, many other occupations, so don't feel like you have to be confined to these healthcare workers. So I just want to talk a little bit about the healthcare workers. So part of the reason that we chose healthcare workers to focus on is that they're a rapidly growing sector in the economy. And so right now, healthcare already accounts for 1/6 of the US economy, and it's expected to grow significantly. And so this table you're seeing here is from the Bureau of Labor and Statistics, and this is the 2014 to 2024 employment outlook. And 20 of the 30 fastest growing occupations are in healthcare. And so this is a really booming field, and it's booming for a lot of reasons, but one of the big ones is as people age, they require more healthcare workers, and baby boomers are hitting retirement ages, and so as a bigger and bigger portion of our population ages, they need more healthcare. And they can also talk about the ACA implications that had a big impact on the healthcare field, and more people getting preventative care and just getting health insurance in general. So now I want to walk you through how to access our reports. So on NHC's homepage, if you go to the research drop-down menu, we've got a section, research tools, and Paycheck to Paycheck lives there. Or you can just scroll down so you can kind of see this is the same picture as before. And you just scroll down, and right here, we've got our Paycheck to Paycheck tool. So this is what the site looks like. And here you can download the tool, or download the report, excuse me, or you can go to the database. And in addition to the report and the database, we also have ranking sheets that list the most to least expensive homeownership and rental markets for 2017. And then we compare them to where they were in 2016 to see how much they've changed. And those are all available in PDF versions on our website. And so what you're seeing over on the left-hand side of your screen is a screenshot of the entire page. I know it's not legible, but if in the bigger portion, I pulled out a portion of it. So this is our data tool. So as I mentioned, we have the 203 metropolitan areas, or the 83 occupations. So you can decide if you want to sort by metropolitan area, or you can go in and select a home health aide and look at 5 different metro areas. Conversely, you can look at Akron, Ohio, and look at, I think it's 10 different jobs is what you're allowed to, the maximum you're allowed to put in. And so this is really designed to be very user-friendly and allow you guys to generate your own reports based on what you need. And then this next section just talks about our methodology a little bit. So as I mentioned, we use HUD data for fair market rents. We use the salary data from salary.com, and that is proprietary data that has been purchased. So unfortunately, that's the one data source that we're not allowed to share. In a bulk way, I should say. We obviously share it in the data tool. And then for median home price sales, we use data from the National Association of Home Builders, and when they have gaps in their data, we use data from the National Association of Realtors. And I should say, just a caveat, that 202 of the metro areas are FMRs as published by HUD. The Dallas metro area is required to use smaller FMRs as a result of a legal settlement. And so we took all of their small area FMRs and averaged them out to create a metro-wide FMR. As some of you may know, HUD was considering implementing small area FMRs on a wider scale, but that rule got pulled back. So this is something that we're hoping to implement in the future and allow you guys to look up housing data by smaller FMRs, but this year that was not something we wanted to implement because HUD had pulled the rule. And so then on calculations, we publish a methodology. So if a lot of times we'll hear from state and local governments, especially local governments, that the home price data or the wage data is a metropolitan, and it's at that level, and it doesn't reflect home prices in a growing neighborhood or in a growing section of the city. And so we encourage you to replicate our methodology and use the best data that you have. And it really takes you through a step-by-step process. And for some of the assumptions, we use a 90% loan to value, essentially a 10% down payment, and we also assume 28% affordability for homeownership and 30% affordability for rental. So that's kind of a quick overview of our methodology. If you have any questions, you can feel free to type them in the chat box or reach out to me personally. So then now I want to go through the report. So this is our lovely report. And so this is one of the first graphs in the report, and it just gets at the affordability of the ability of these occupations to afford anything. So you can see for most of them, they're below 50%. So I want to break out these percentages. So over here, we've got rental, and for home health aides, they can afford one metro area, and that equals 0%. For physical therapy aides, they can afford 2 metro areas, aka 1%. For EMTs, they can afford 41 metro areas, or 20%. For dental assistants, they can afford 69 metro areas, or 34%. And for licensed practical nurses, they can afford 163 of the 203 metro areas, or 80%. Kind of same thing over here. You can see that homeownership is harder for EMTs and dental assistants, and we actually see a little bit of a rise in physical therapy aides and home health aides, and that's largely in metro areas where the home prices are still deflated from the housing crisis. And so there's some areas where they can afford to purchase because the prices of homes are below $100,000. And so in those areas, homeownership might make more sense than renting. So now I want to talk through the wages. So the national median household income is $55,755. And you can see that for all of the occupations that we've selected for this report, they fall below that. Most of them are below 70%. Licensed practical nurses come out at 82%. But they highlight a nice range from 50% all the way up to 80% of these are people who are working and are still really struggling to make ends meet. And for some of them, even with two incomes, it would still be below the national median household income. So this is what one of our charts looks like if you were to go online, and we can walk through a little bit of what it looks like for how you can create these reports. So this is Youngstown, Ohio. So this is a good example of a metro area that is still struggling to come back from the foreclosure crisis. And so these are the rental prices. And you can see everyone's doing pretty well. Home health aides might struggle a little bit on the 2 bedrooms, but they're about where they need to be. And then for the homeownership market, you can see that they're doing well. So this gets back to what I was saying earlier, that in these types of markets, purchasing a home may make more sense. And then we go to somewhere like San Francisco, and the housing prices there are astronomical. And so you can see it would take $120,000 to be able to afford a 2-bedroom rental unit. And so even if you had 2 or 3 incomes for some of these occupations, they would still be well below where they need to be. And homeownership is even worse. It would be very, very challenging for them to be able to afford a home on these incomes. And part of the reason that we do this report is that these are valuable jobs to communities. Communities need EMTs and home health aides and all of the occupations, not just in this report, but in the larger 83 that we've selected. And really any functioning community should have these. And so we, as a society, have said these are valuable occupations, but how do we make sure that they're able to live in the community in which they serve? So that gets me to policy solutions. So on the federal level, there's a bunch of programs at HUD and USDA and the Veterans Administration that get at housing affordability. You have things like rental vouchers, which will pay the difference. So it'll make sure that someone's housing costs are 30% of their income, and then the voucher will cover the difference between 30% of the person's income and the cost to rent that place. And then we also have programs like HOME and the Community Development Block Grant, which provide gap financing to help make affordable housing possible. And that usually couples with the low-income housing tax credit, which is by far the largest investment that the federal government has made in affordable housing. And that's a production program, so it both builds affordable housing and preserves existing affordable housing. And then the other ones, so the Federal Housing Administration offers low-cost financing for first-time and low-income home buyers. So for our assumptions, we assumed a 10% down payment on homes. For FHA, you can go down to 3% of a down payment. So that might allow people to save up quicker and be able to afford a house. For USDA and the Department of Veterans Affairs, they offer guaranteed mortgages for veterans and low-income people. And then the federal home loan banks, through their 11 regional banks, they provide capital for purchase, construction, and rehabilitation of homes. And the other thing that is not on this list is the National Housing Trust Fund, and that works similar to the HOME and the CDBG programs in that it provides gap financing, and it's targeted to very low-income people. And the final thing on the federal level that I want to mention is housing finance reform. So Fannie and Freddie have been in conservatorship since 2008, and that was originally intended to last for a short period of time, but it has been 9 years since they've entered conservatorship. And so part of this is reforming the housing finance system and making sure that people have reliable access to credit. That is perhaps the most important thing that the federal government can do. And then on the state and local level, many communities have similar programs as the national level, but on a much smaller scale. So some of them have state-run vouchers, state-run housing trust funds, or state and local homeownership assistance, things like down payments, or conversely for rental, first month's rent, and helping to purchase furniture, that kind of stuff. One of the other big things that state and local governments can do is inclusionary zoning. And so currently we are aware of over 500 jurisdictions that use inclusionary zoning. So typically inclusionary zoning laws allow developers to build higher densities or ease other requirements in exchange for them including affordable housing in their building. Or if they don't want to include it in their building, they can pay an in lieu fee, and then that money will go to the state or local government that's running the inclusionary zoning program, and they can use that money to build affordable housing. The other thing I want to mention is this 80 to 100%, 120% AMI assistance. So if you remember back, let me just go back to the slide. So licensed practical nurses are making 82% of the national median household income. And so we've been hearing, especially in high cost markets, that they've been really struggling to afford to live there. And so there's a couple of examples of state or local programs where they're targeting that 80 to 100% AMI. And so in the report, we highlight Massachusetts' recent campaign to create affordable housing for 61 to 120% AMI. And then the last thing I want to mention is employers, and they can play a role in making sure that their workers have access to affordable housing. So in the report, we profiled the Henry Ford Health System, which is in Detroit, and they created a program called Live Midtown that is the surrounding neighborhood of the health system. And so they offer different types of assistance to their workers. And this was part of a process of revitalization in that community. It suffered years of neglect, and the hospital, or the health system, I should say, served as an anchor institution and made investments in the community and also made sure their workers lived nearby. So employers have a role to play in this too. So this is my contact information, but before we close, I want to show you guys how to create the reports. So if you're on our webpage, as I mentioned, you can go to research and research tools, or you can scroll down and here's the database. Give that a minute to load. And so in here, you can select a metropolitan area. So we'll select Austin, and then you can choose occupations. So you can choose up to 10 occupations, and this is what I was getting to, those 83 occupations. You don't have to feel limited. So you can just select a few. I've just clicked randomly, and then click Create Chart. And it'll create these really nice charts that are really easy. You just hit download, and they come out just like this. And then we have the data that's behind them, so you can, if you want the actual numbers in a concise way, to do it in an Excel spreadsheet or something, they're there. Let's go back. And then if you want to do it by occupations, so you can choose a case manager. And then you can select 3 metropolitan areas. So, I might want to see what the housing costs are for caseworkers in those 3 metro areas. And we can see both homeownership and rental markets. So you can see the variability. And so what you're seeing down here is a 1-bedroom, a 2-bedroom, and what their salary is. And up here, you've just got the home price, or the income needed to purchase a home, and then their salary. And again, downloadable charts and the data that's behind the charts. So if we go back to our presentation. Sorry, guys, we're going to have to scroll through. Last things that I want to mention before we get to question and answer is Solutions for Affordable Housing. That is next Wednesday in Washington, D.C., and this is one of our annual conferences. And so we're going to be looking at a bunch of at housing problems and specifically affordability. A couple of the sessions that I want to highlight for our plenary, we'll be talking about tax reform and specifically mentioning the low-income housing tax credit and how that will play out in the tax reform process. And then for our other plenary, it'll be housing in disaster or housing post-disasters and looking at how communities that are recovering from a disaster, what they should be thinking about for the long-term housing needs of that community. A couple other sessions that I want to highlight: new solutions for nonprofit rental housing. So we're going to be looking at naturally occurring affordable housing and how communities can finance affordable housing without state or federal subsidy. A couple others looking at the intersection of housing and health and meeting the housing needs of older adults. We've got a bunch more sessions, so I'd encourage you to go to our website, and it's right on the homepage. Registration is still open. And the last thing I want to mention is our annual gala. We just announced the date. It'll be June 14th of 2018, so mark your calendars to attend. And with that, so thank you so much for attending, and have a great day.